This video is about the damp heat syndrome. The question here is that what is common in recurrent infections? So why do infections come, first of all? If you have seen my previous videos, I proposed the theory that infections might come to help us digest waste. And it is particularly true in the case of opportunistic pathogens, when certain bacteria may behave like pathogens in certain circumstances, and in other circumstances they are completely non-pathogenic at all. So there is a transition in this case between colonization and infection, which means that as a ground state, these pathogens or these bacteria or organisms or microorganisms just sit on the skin or any mucous membranes or anywhere among other bacteria, and in response to certain signals, for example histamine, which comes from sterile inflammation, they become pathogens and they start to interact with the host, and this is called infection in microbiology. And what is the solution? Obviously, as I mentioned in the previous video, repairing mitochondria, reducing inflammation and digesting waste via autophagy may be the solution. In Western medicine, we usually cool the inflammation, but we don't do anything else. We don't repair mitochondria and don't digest waste either. We don't repair membrane capacitors either. The medications I'm talking about are antibiotics, antipsychotics, and even some antidiabetic medications. They all just cool the inflammation and causing a transition from damp heat to damp cold syndrome, which means that dampness is waste, so there is a waste heat, which means that a sterile inflammation on the basis of waste dampness, and this inflammation is cooled down and turned into damp cold syndrome. This slide is to demonstrate how we get exhausted, and on the left hand side, you might have seen it from my previous videos. On the left hand side we can see functioning mitochondria, high energy, healthy state, when mitochondria with microtubules may generate a strong electromagnetic field in the cell, and when mitochondria go down in response to certain factors and environmental influences, for example electromagnetic radiation, toxicity, poor diet, simple exhaustion, lack of sunshine, heavy metal poisoning, etc. These mitochondria stop working and they start, and when these mitochondria go down, the electromagnetic field in the cell also goes down and becomes weak. When mitochondria go down, so there will be subsequent lack of energy, and with lack of energy, metabolism also slows down and we start making waste. And in response to this waste production and to substitute the missing mitochondrial function and energy production, we start sterile inflammation, which is on the right hand side of this diagram. So this is basically the process. There is another aspect of infectious diseases, which is emotional coping. Worrying and overthinking may exhaust mitochondria. The extreme condition we can see is PTSD, post-traumatic stress disorder. Empathy, sorrow may also play a role in this process. We talked about lactate and lack of energy, lactate buildup, and the unfolded protein response, which is basically the waste production in the endoplasmic reticulum when there is no energy to properly fold proteins, and there will be a lot of waste proteins produced in the body. And these pathogens may help to digest waste, and there is a biofilm being formed. This is basically the bacteria plus the waste together. What could be the solution? Basically to regulate susceptibility, and this waste build up with the missing mitochondrial function and the conjoint sterile inflammation is called susceptibility. You can see that from my previous videos that herbal saponins may act as membrane softeners, and the membranes can function better with these herbal ingredients. We also support mitochondria with ginseng, astragalus, licorice, cinnamon, and fenugreek. We also keep our body clean with vegetarian diet, which is easy to digest, and there is less biofilm production. And the reason why I put this slide here is because we mentioned least but not last is to induce biofilm digestion, which is autophagy. When do we need to think about inducing biofilm digestion or autophagy? When we have signs of biofilm formation. Clinically, the following signs and symptoms may indicate the accumulation of biofilm: bacteria and waste, or waste plus minus bacteria. In the case of depression, headaches, insomnia, bipolar disorder is particularly important, because in Chinese medicine, bipolar disorder is due to a biofilm formation. Psychosis, impaired reality testing, when microtubule may get polluted, and there will be an impaired sense of reality. Depression with chronic sinusitis, there is indeed a link between depression and chronic sinusitis, maybe because the smelling system, the olfactory system, is part of the limbic system, and when the limbic system is in inflammation because the mitochondria there become exhausted due to overthinking and worrying, there will be a subsequent waste production and inflammation and swelling, and the limbic system as well as the olfactory system may start discharging, and we can see that as sinusitis. Glaucoma is the same thing in Chinese medicine, biofilm and dampness. Dampness is nothing else but anything, lipids, usually proteins, carbohydrates, whatever, which are present in excess of how they should be, and this attracts water, and this is called dampness in Chinese medicine, or biofilm in Western medicine. If we go further down in the body, we can see productive cough in the lungs as a sign of biofilm formation. In the stomach, we can see biofilm as nausea, poor appetite, fullness in the stomach, and on the other end of the digestive system, mucus in the stool, and perhaps diarrhea. And here diarrhea is nothing else but a sign of mitochondrial dysfunction and impaired digestive function. Obesity and arthritis are also signs of biofilm formation because, for example, arthritis, the joints are areas of low perfusion even in Western medicine, and if there is decreased or reduced or impaired peripheral circulation due to dampness and biofilm in the blood, so the blood becomes thick and dense, so it cannot circulate properly, and we can see this as a sign of drop in the osmotic or colloid zeta potential in the blood. We can easily imagine that this thick blood cannot perfuse the circulate around the joints easily, and the structured water in the joints gets weak and becomes weak and cause arthritis. At the other end of the body, in the gynecological area, we can see white vaginal discharge, various gynecological conditions, for example, polycystic ovarian syndrome causing infertility. But any sort of infertility may be due to biofilm formation in the uterus and in the ovaries. And this is very often due to either hormonal insufficiency, what the Chinese call liver blood, or estrogen deficiency, or the Chinese call it Qin Yang deficiency, which is basically low cortisol or lack of cortisol or adrenal fatigue and lack of sexual steroids from the adrenals. Amyloidosis, which is basically a buildup of proteins in the body. Very often spike protein may also be regarded as biofilm. Certain paraproteinemias, in the case of hematological diseases such as multiple myeloma and lymphomas, may also be classified as biofilms. Myasthenia gravis in Chinese medicine, which is due to weak mitochondria and an accumulation of misfolded proteins as an excessive condition, it is also regarded as biofilm formation in Chinese medicine. This slide, we can see digestion blockers and their use in Western medicine. Digestion or autophagy blockers may be used in cancer treatment because cancer cells, in response to these materials, they stop metabolizing chemotherapeutic agents, and therefore their concentration increase in cancer cells and causing apoptosis and cell death. Matrin in gastric cancer, elaiophilin in ovarian cancer, oblongifolin in other types of cancer, just like frontosine, may be regarded as autophagy blockers in this article. There are autophagy or digestion inducers on the other hand. For example, magnolol and Salvia miltiorisa and honokiol. It is the same article I quoted here. The reader or audience can easily find it online. This is another aspect of the application of autophagy or digestion blockers in modern medicine. In cancer, interestingly, certain antacid medications may block autophagy. They are called proton pump inhibitors according to this article, and as they block autophagy, not only in the gastric or stomach cells, but as well in the body. So they block autophagy, and there will be a subsequent waste buildup, and this waste may spill over and go into the blood, sticking red blood cells together and drop the zeta potential, and it may cause blood stasis or blood sludging. This blood sludging or blood stasis can be seen, or thickened blood or dense blood can be seen as distended sublingual veins in Chinese medicine, when the veins in the mouth under the tongue become dilated, and this is another sign of extended or advanced inflammation in the body in Chinese medicine. This little diagram shows the different adverse effects of proton pump inhibitor utilization. We can see the respiratory system with productive cough, and this excessive cough may get infected, and certain chest infections, bronchitis, pneumonia may arise in the stomach. We can see it as gastric cancer, nausea, vomiting, as I said, and when there is a subsequent or resultant inflammation, we can see constipation, or at the other end we can see certain gastrointestinal infections such as Helicobacter pylori infection or Clostridium difficile, diarrhea as a result of biofilm formation and dampness and waste buildup in the bowels. In the musculoskeletal system, it is usually paired with mitochondrial weakness. As in the previous system, the gastrointestinal system, the mitochondrial weakness may be seen as impaired digestive function and diarrhea. In the musculoskeletal system, we can see it as impaired muscle strength or reduced muscle strength, and certain myopathies. In the central nervous system, we can see it as headaches, depression, bipolar disorder, and dizziness. Dizziness is important here because dizziness in Chinese medicine, or we can see it even in Western medicine as Meniere's disease, is regarded as a result of the thick blood. The dense blood cannot circulate through the blood vessels of the brain easily, and it may even cause TIA, transient ischemic attack, in Western medicine, which according to Chinese medicine is classified as due to a drop in zeta potential. In the cardiovascular system, we can see it as acute coronary disease, as a shedding of the endothelium, the inner lining of the blood vessel, and due to the thick blood unable to circulate through the blood vessel wall, and the endothelium, the inner lining of the blood vessel, becomes shedded off the vessel wall and causing vasoconstriction. This may contribute to hypertension, for example. In the kidneys, we can see it as acute and chronic kidney disease, and in the blood, we talked about various conditions already. This is another article talking about proton pump inhibitors and immune dysfunction, and as a response to impaired autophagy and digestion. This is another slide about the importance of digestion or autophagy in the case of neuroinflammation and neurodegenerative diseases. We are talking about Alzheimer's disease, Parkinson's disease, amyotrophic lateral sclerosis, and other chronic degenerative neurological conditions. This is an article about a Chinese herbal formula, Bush and Jie Fang, in the role in the treatment of Parkinson's disease, because it may induce autophagy and help Parkinson's disease. This is another example of autophagy and neurodegeneration. As I just recently said, we can see various chronic inflammatory conditions in the brain and their involvement in, or the result, they may be the result of impaired autophagy. We can easily think that all these patients are usually traumatized, emotionally traumatized patients with overthinking, spinning their mind around unresolved emotional traumas or repeated emotional traumas as a result of an ongoing or repeated emotional trauma. And this weak or dysfunctional mitochondrial pool cannot make enough energy to fuel a normal physiological metabolism, and it may lead to a metabolic waste buildup, and therefore this waste needs to be digested again. But once this, up to a certain extent, until a certain extent or after a certain extent, this autophagic capacity becomes saturated and exhausted, and then this neuroinflammation kicks in and autophagy goes down. We can see Western medications which may induce autophagy and digestion. Metformin, methylene blue, clonidine, minoxidil, verapamil. Interestingly, amiodarone is also said to be an inducer of autophagy, and this may be the mechanism behind the antiarrhythmic effect of amiodarone. This slide is another aspect of autophagy modulation in the management of asthma by traditional Chinese medicine. We can see various herbs here which may act as autophagy inducers in the management of asthma. This slide is also about neurodegeneration and autophagy. Turmeric, geniposide, berberine from Philodendron amurense, and peoniflorin from Paeonia lactiflora and Paeonia rubra, glycyrrhizic acid from Glycyrrhizia glabra or uralensis liquoris may act as autophagy modulators and have a beneficial effect in neurodegenerative diseases based on this article. Autophagy, again, in neurodegeneration, we can see that on one hand there is obviously a metabolic waste buildup, but on the other hand there may be an effect of metabolic waste buildup and its effect on microtubular destabilization. So what are we missing in intensive care medicine, in my opinion? We don't support mitochondria enough, at least. We give some steroids which may support mitochondria, but this may not be enough. We don't induce waste digestion autophagy, and we don't repair membrane capacitance either. This is called yin tonification. Yin is tissue basically, and yin support in Chinese medicine, and therefore we don't repair membrane capacitance according to Chinese medicine. Final thoughts. Antibiotics and antipsychotics, Western medications, usually just cool this sterile inflammation in response to metabolic waste buildup, which is called damp heat syndrome in Chinese medicine. We just turn this damp heat syndrome to damp cold syndrome. So when we treat these patients, we usually need to warm them up because they become sluggish, they slow down, they gain weight in the form of waste and water accumulation, edema accumulation, and their thinking, their mental processes usually slow down, they become depressed, and their digestive function, their sexual drive also go down. They get low back pain due to adrenal fatigue when they cannot produce more steroids to support their mitochondria. So this is basically a damp cold picture, and we need to warm it up again with Chinese medicine, and we need to induce autophagy, so digestion of waste or dampness, and we need to eliminate the water which was originally attracted and bound by this waste buildup. So in alternative medicine, reversing back to heat and so warming up, not necessarily the inflammation, but we warm the mitochondria back to normal, and we start digesting this waste. This is the strategy behind our treatment. We repair mitochondria and induce autophagy, as I said. Two examples are Wendan tongue and Shao Chai Hu tongue. You can see them here. I don't go into details. I already said or talked about the therapeutic strategy behind them. So this is our discussion about recurrent infections and dampness and metabolic waste buildup. Thank you for your attention. You can see my website here. Feel free to get in touch. Thank you, and see you next time.